Welcome to the Breaking Pain podcast. I'm Dr. Zamir Parani, an interventional pain specialist in Toronto, Ontario. This is where we break down pain one conversation at a time, because your pain relief starts with your understanding. So you've been told you have back pain, maybe a herniated disc, maybe spinal stenosis, or nerve compression, but you're not sure if surgery is the right choice for you. That's exactly what we're talking about today: pain intervention versus surgery. I'll be breaking it all down with today's guest, Dr. Colby Oitment, our esteemed spine surgeon and excellent colleague of mine, so you can feel confident about your next steps. If you've been told surgery might be an option, but you're not ready to commit, this episode's for you. So, welcome, Dr. Oitment. Thanks for joining us again on the Breaking Pain podcast. So, we talked about some indications for surgery, some patient considerations, some surgical considerations in a previous episode. Now, many patients often ask a very legitimate question: when is an intervention better? When is spine surgery better? And the way I like to reframe that is like, well, how can we work together to decide the best course of action for you? So, for example, the healthy patient, healthy A, who's a 35-year-old with radicular nerve pain that shoots down the leg into the foot. It's electric, there's numbness. How do you, if you saw this patient for the first time in your surgical practice, how would you counsel this patient on, whether going for an intervention or going straight to surgery?
If somebody's reasonably functional, so they're in pain, but they can still get through the day, typically we wait sort of 6 weeks, and there's an overwhelming probability, at least 80%, in those cases that someone with a disc herniation is going to take care of it themselves. I typically recommend an acute injection there because it helps you get through that first 6 weeks to treat that. So to me, surgery is always last resort. I always prefer low risk options first, and to give the body an opportunity to heal itself.
Yeah, and I love that you said that because, in our group here in Toronto, Ontario, we really, really want to, reiterate the point to our referring physicians that we want to prevent acute pain from becoming chronic.
Yes.
Because as we know, when something goes from an acute on chronic to chronic pain, and we've said that, chronic pain is pain that lasts for greater than 3 months, it can become a little bit more challenging to treat in our patients, right? And so I love that you said that, getting an acute injection may be beneficial because that may cure them, that may improve their pain trajectory, that may prevent, surgery, the need for surgery. Then we also have other patients that you see in your practice that, maybe they're a little bit more elderly, they've had surgery in the past, and you're planning potential revision surgery, which we call, or a second surgery to delineate some of their pain. And how can spine intervention or interventional pain management, collaborate and actually complement surgery that you do?
So especially if you're talking about the elderly, where surgery is a little bit higher risk, and often the surgeries needed are a little bit bigger and riskier in themselves. Sometimes we use injections and interventional options like ablations to just push off surgery as long as possible until both I and the patient know that now is the right time to embark on that. We've exhausted all of the conservative options. So that's one option, is to therapeutically use these interventions to push off surgery as long as possible until it's the right time. The second is, and we often do this together a lot, which I love, is that we can find in patients who have compression at many areas of the spine, and we're not exactly clear which one's driving the symptoms. Sometimes we can target, through the use of injections, different areas of the spine to figure that out.
Just relating it to this spine model here,
So what I'm talking about is, let's suppose, and you get this in many patients over the age of 60, 65, 70, all of these discs may be contributing toward compression at all these levels. And someone's symptoms may be non-specific. It may be the entire right leg.
Right.
And so we don't know where exactly to target a surgery. However, if you go in and you do one injection that completely relieves their symptoms for a period of time, sometimes we can use that information to guide one minimally invasive decompression in an area in which otherwise you would need a big risky fusion.
So essentially what you're telling me is that with complementary spine intervention, we can actually reduce the risk of unnecessary surgery. We can potentially make a large surgery where you're showing 5-6 levels in the spine and maybe reduce that to 1 or 2 levels. And we know that patients will have a better outcome because I'm assuming it's less risky, less blood loss,
of course,
better, easier to rehab, less pain.
And some patients are not even a candidate for those big surgeries. So they'll be told, sorry, you're not a surgical candidate. Go home, go to physiotherapy, go try pills, and they're depressed, they're feeling, there's no options. Whereas once we start these diagnostic injections, if we find that one little area, let's say down here from L4 to S1 solves 80% of their problem, maybe you are a candidate for a small procedure at the bottom where we don't do this whole thing that's high risk.
So that's really the collaboration. And I think it's really important for our listeners to understand that if you're going to a pain clinic, right, the pain clinic must be specialist led. There must be people who have specific training in pain. And you also have to look at the facility. Are you getting pain injections with an x-ray? Because the only way to do this, of what you've described, is to have a specific x-ray guided intervention here where we can actually go to that nerve road.
I can't tell you, Zara, how many patients I've had that come in and they say, I don't even want to try injections because I've already gone for 3 years to some clinic where every week they inject me with local anesthetic. And I tell them, you're not getting the right treatments. You're getting some treatment, but you're not getting the right treatments for what you need.
Right.
And so I think it's critical that we have the opportunity to take these patients and get them targeted therapies by a pain specialist who understands the anatomy, or a surgeon who understands the anatomy, who can use x-rays or something more specific than ultrasounds to get the right treatments on the right nerves.
Right. And so really what we're doing is we're advocating for patients. And sometimes, maybe it's a little bit of a drive for them, right? But, we can make a massive magnitude of difference if we actually do guided interventions. And then, a patient, some of the patients that I've seen from your practice, they'll say, well, I don't want any more steroids, right? So I always say, are steroids bad? Well, in the acute period when we're actually trying to find out the level, they can be diagnostic and therapeutic. So a little small amount of steroid, just to calm down some of that inflammation on that nerve or in that, this in the canal may have a large magnitude of difference. And, in my practice, I usually only give the first dose is usually steroid. And then after that, I usually do procedures that are steroid sparing. And, in our elderly population, I think that's really, really important. And you need to be able to send your patients to a clinic that has that, expertise on how to manage patients, because as we know, the steroids can be harmful to patients if they're in high doses and they're all the time, right? So, we can, what we've talked about is that, you can do the straightforward surgery. And so interventions can guide for that straightforward single nerve route, whether you need a surgery or not. They can also prevent major surgery in our aging population that may have some of these complex medical conditions that we've talked about, right? And I think that's really, really beneficial for patients, right? Are there any other kind of other roles that you see for spine interventions versus surgery in some of your patients?
I think so. Mainly is informing the diagnosis when you're not sure. Right. And then in sort of the therapeutic use of these interventions to avoid the surgery, I would say those are the main two. I have a lot of patients that are, very frail, elderly. The type of surgery they would need would be extremely high risk, and they're not interested in that. They want to they'd be happy with a 30% improvement in pain and a little bit more function just to help them get through the day. And so a lot of these, not just steroid shots, but other options that we have through these pain clinics can get them there. Right. And so in that case, we're reaching their goal without the risks of these big surgeries. Right. So that's
and then beyond the interventions, and I know we'll speak about this in future episodes, is that whole holistic component is bringing all the pieces together, that pharmacology, the physiotherapy, the procedures, and really managing their mental health, right? And so when we put these all together, we're really improving the trajectory for the patient's quality of life. And I know as a surgeon, you don't want to do unnecessary surgery on patients that may actually harm them and make their outcomes worse, right? So thank you for this wonderful conversation, Dr. Oitment. We've actually covered a lot of really important topics, and hopefully, created some good information for some of our patients to reduce some of the myths associated with spine interventions. I think really importantly is that for patients, my message is, you might not be in the Toronto area, you might not be in Ontario, you might be in a different province, a different country, but when you're considering spine interventions, it's really, really important to ensure that you're going to a place that has image guidance, that the physicians are specialist-led so that they have specific training in chronic pain, that the clinic not only just focuses on interventions, but also medication management and getting you into physical therapy and all those holistic approaches that we're going to talk about more, but are really, really important. Well, as you know, I like to finish off with the 3 most important takeaway points for spine intervention, but versus surgery, and what would those be in your opinion?
I think let's say the 3 take homes in this case would be that it doesn't have to be one or the other. We can work together to try and create the best treatments for the patient. So what that means is, number 1, let's say you've got an acute disc herniation and it's sciatica, it's really troubling you down the leg. These small nerve root blocks, which are very low risk, can actually bridge you to the point that your body fixes the problem. You don't need a surgery. Okay, That's number 1. In older patients, for example, this would be number 2. I think you're looking at potentially embarking on a very high risk surgery. I would consider some of the options that we have in terms of therapeutic treatment. If you can get 5 years out of it, that's worth it instead of jumping into these risky surgeries. And so I would say consider it at least. Number 3 is that if you've been told you're not a surgical candidate because the surgery you need involves too many of these levels and you're too high risk, consider using your local pain clinic to try selective blocks to see if there's one area really driving most of the symptoms. Sometimes, not always, but sometimes we can come up with a smaller surgery that's more appropriate in terms of risk and minimally invasive to really treat the majority of the problem without fixing the entire spine with screws and rods.
Those are excellent takeaway points, and I agree with all of them. And I think that's really, really important for our patients. So to recap for all our viewers is that not all back pain needs surgery. Pain interventions can help many people. The decision depends on your symptoms, function, and pain severity. It's okay to take time to decide, but delaying too long can make surgery less effective. Still unsure about surgery? Still unsure about interventions? So have questions about any pain interventions? Send them in. We might answer them in future episodes. Just remember, making informed decisions is the most important step. That's why we're here, to break it all down for you. Remember, this podcast is for educational purposes only. Speak to your doctor for personalized information. Next time we'll talk about what else can I do beyond surgery, beyond interventions, beyond injections. We will discuss the movement, mind-body connection, nutrition, sleep, recovery, and complementary therapies. Don't miss it.